Hi everybody, my name is Dr. Claire Relton. I'm a Senior Lecturer in Clinical Trials at Queen Mary University London in the UK, and I'm also an Honorary Senior Research Fellow in Public Health at the University of Sheffield, and I'm here today to talk to you about the power of the patient voice and describe to you some practical tools and methods for creating evidence for COVID and beyond. So, power of the patient voice, practical tools for creating evidence. I'm going to talk to you about the Health Hawk collaboration, VHawk, the Virus Health and Wellbeing Checker tool, and the National Health Study Platform. So 3 things. So firstly, the power of the patient voice. Also known in research fields as the patient-reported outcome measures. So, patient reporting how they are, also known as PROMs. So the story begins when I was offered an amazing opportunity to work as a homeopath in Sheffield in the PMS menopause clinic there in 1998. So myself and Dr. Pat Strong were invited to treat menopausal patients who couldn't take HRT or didn't want to take HRT with homeopathic medicine. It was a great opportunity, but as part of the opportunity we were told that we would have to collect data from the patients from every consultation. So we were very nervous. All our lack of confidence with regards to our own particular clinical skills and homeopathy came into play, but it was a great opportunity, so we decided, okay, let's do it. So very nervously at the beginning, at the end of every consultation, we would ask each patient, so tell us about the symptoms that you have, and choose the 2 symptoms that bother you the most, and then score them on a scale of 0 to 6. With 0 as good as it can be and 6 as bad as it can be. And now also tell us about your general well-being and any activities that your symptoms are actually stopping you from doing. So much to our surprise, we actually found the patients really liked it. It helped them focus on why they had walked through the door, why had they come to see us. And at the follow-up consultations, it helped them focus on how they had been and gave us a really nice little assessment tool for measuring what benefit had been, what progress had been made since the last time we'd seen them. So as a result of this, we did this we worked at the menopause clinic, the NHS menopause clinic, for 8 years, and we collected these patient-reported outcome measures. So we listened to the patient voice, and the patient wrote down how they were for each consultation, and we had a growing pile of sheets of A4 with the patient voice on. So after 3 years, I then collected all of them together, and we collated them and published them as an audit. An audit, which is something, means that you listen to something. So we had 125 patients by that time, and we had their MyMop forms from almost every consultation. So we analysed all the data, anonymised it, and produced this audit, which was an aggregate report of all the aggregate data that we'd had from all those patient consultations. It then got published in the Journal of the British Menopause Society and provided a small piece of evidence as to the effectiveness of treatment by homeopath for women with menopausal problems. Then, as a result of this, I was then able to provide enough evidence to persuade the people I needed to persuade in order to run a randomized controlled trial of treatment by homeopath. So this is what we did. By this time I was now working both as a homeopath but also as a researcher, trainee researcher at University of Sheffield, and I was doing a Master's in Health Services Research and then a PhD. And I decided I wanted to do a PhD and I wanted to run a trial of treatment by homeopath for women with menopausal hot flushes, and I wanted to design it in a way that would make sense to me and the patient and the people who funded the care that we provided. So this is what I did with my colleagues and my supervisors, and as a result of that we published the trial, which showed the effectiveness of treatment by homeopath for women with PMS and menopausal problems compared to no treatment or treatment as usual. As a result of this project, we also actually created a new trial design, which is now known as trials within cohorts, which is a very practical trial design which relies on the patient voice to a great extent. So there's yes, there's the MIMOPS, and there's the report. So I was so impressed by the power of the patient voice, by the power of patients actually reporting the symptoms that their symptoms, and reporting them, and doing this routinely, so collecting what we call routinely collected health data. I thought I wanted to help other practitioners, homeopaths, other complementary and alternative medicine therapists, other practitioners of all types, to collect data to make each of their cases count. So we set up a website called Making Cases Count, which is still going today. And we spent a lot of energy encouraging homeopaths and other practitioners to collect routine data from their patients, so to enable their patients to speak about how they were. So we're very good as practitioners in talking to other practitioners in the same domain. So I'm a homeopath, or was a homeopath for many years. So it's a profession that I love, and as homeopaths, we're very good at talking to other homeopaths about what we think about our cases, and we write them up and we publish them in journals, we present them at conferences, and we talk to other homeopaths about what homeopaths think about what happened to their patients. But rarely do we actually enable the patient to speak directly. We talk about what the patient said, but it's our reports and our analysis of what the patient said, with our theories and our philosophies. There's something really powerful about letting patients just speak and collecting that data and providing that data, as you can see. So quite a few homeopaths started joining, Making Cases Count, and collected routine data on their patients and published things, which is fantastic. So you may recognize some of those faces there. But only a very small proportion of the profession actually moves this forward. So collecting their patient data, data from patients using the patient's voice rather than the homeopath's voice, provided lots of opportunities for me over the last years and my colleagues. So we conducted a number of trials comparing treatment by homeopaths plus usual care versus usual care alone. So in addition to the hot flush one, so the first one was fibromyalgia syndrome by Jackie Rohr in Barnsley. Menopausal hot flushes is the one I did. That's the publication. And then irritable bowel syndrome with Emily Peckham, depression with Peter Vixveen, and most recently ADHD with Philippa Fiebert. So these are all great studies that have all been published, or using randomized controlled trials. So patients are randomized to either receive treatment by a homeopath plus usual care, or just usual care alone. And they've all demonstrated positive effects of treatment by a homeopath. They've all been quite small, but they have all demonstrated the effectiveness. So now along comes COVID, our new era, through which we see everything. So everything is seen through a COVID lens. COVID is affecting all aspects of our lives. So what do we need to ask of patients in this new COVID era? So about 8 weeks ago, my colleagues and I created something called VHAWK, which stands for virus. Actually, I'll talk about that in a minute. So let's just have a little look at randomized controlled trials. So the current system for producing evidence that's regarded by the powers that be is very interesting. I've been watching this over the last 20 years as I've been involved in health research. Firstly, in order to run a randomized controlled trial, we know it's massively expensive. It costs many millions of pounds usually. Quite often the populations who are recruited to these trials are not representative of the population to whom we then want to generalize the results to. An amazing 50% of trials actually fail to recruit enough people, despite millions of pounds of funding. And what's created is a jungle of trials, as those of you who actually try and make sense of the evidence, looking at systematic reviews and meta-analyses of systematic reviews of randomized controlled trials, you will know it's a complete jungle out there. It's very difficult, everything is very complex and different, it's very, very disorganized. So generally, the mainstream system, the standard system that's been operating for the last 30, 40 years, is very inefficient in actually producing knowledge which is useful, knowledge that works, knowledge which helps inform patients, practitioners, and those who supply and fund healthcare. So the current system is poor value for money and poor value for the public. It's impractical, and in many ways, it's actually unethical. So it's not just me who's critiquing the current system for generating randomized controlled trials and saying it's not fit for purpose, but actually Janet Woodcock, who's a director from the FDA, says, I believe the clinical trial system is broken. I do, but I do not believe it serves the interest of patients. So there's a lot of people working very, very hard in health research, particularly in the randomized controlled trials field, who acknowledge that the system is not working, but the system is the system and it's carrying on. But now we have the COVID era. So at the beginning of this year, when COVID started to come on the horizon, I started off a collaboration of like-minded people who recognize the inefficiencies of the current system and wanted to build healthy health systems, health systems that actually work, health systems that could react to both and address efficiently and equitably the challenges that we face as a nation, as a globe, to our health. So not just for acute disease like COVID, but also all those chronic diseases which we know are out there and are supported and continued by the current systems we have, both economic, financial, and research. So our strapline for Health Talk is we want to build healthy health systems, one voice at a time. So the common denominator in all research into health is the patient. That's the common denominator. You can talk about all sorts of different trial methodologies and systematic reviews and statistical techniques and measurement tools, etc. But the common denominator is the patient. And how is the patient? And the best authority on how the patient is in terms of their health usually is the patient. So why don't we let them speak? So with Health Talk, we're rebuilding, trying to rebuild or encourage, make existing health systems healthier by prioritizing and enhancing the power of the patient voice, one patient at a time. So this is where you and your patients can actually help build healthier health systems. So we've got a fantastic team of people. It's growing all the time. And it's a really diverse mixture. I want a really diverse mixture of people in this team. So we've got professors of global public health. We've got directors of the Royal London Homeopathic Hospital. We've got directors of research. We've got professors of respiratory medicine. We've got surgical professors. We've got lots of complementary and alternative medicine therapists and academics. It's a fantastic team. So if you're interested in joining, just contact us. So we want to build healthy, what we're united by is the idea and the vision of building healthy health systems, one patient voice at a time. So the COVID lens, we're seeing everything through COVID, aren't we? Every action, everything we do, every aspect of our lives now is seen through the COVID lens. So who's got it, who's had it, who has immunity to it, how do we prevent it, how do we manage it, how do we recover from it if we get it, what treatments are actually people using, what services are people using, and what impact is COVID having on this aspect of our lives, or this aspect of our work, or this aspect of our society. And of course, the question that's uppermost at the moment is when and how should lockdown be lifted. So, in order to empower patients in this new COVID era, we've created a new tool called VHawk, and it stands for Virus, Health and Wellbeing Checker. And it is what it says on the tin, really. It's about the patient speaking about how their health and well-being is in relationship to the virus, but also generally it's an overall checker. So VHawk, Virus, Health and Wellbeing Checker, it's a simple tool to listen to patients and the public. So anybody with a voice can use this tool. It's a patient, as I mentioned right at the beginning, it's a patient-reported outcome measure, a PROM. So it's actually patients can report how they are, what happens to them. and it can be used as a tool to actually measure change over time. That's what an outcome measure is, something that measures the outcome of something over time. It's a simple tool. We ask about COVID status, health-related quality of life, general health, treatments people are taking, and care they're receiving. So these are the questions. Do you currently have any of the following symptoms? We've got a list of 13 symptoms related to upper respiratory tract infections, influenza, and the two most common COVID symptoms. Have you had a diagnosis of COVID? If you have, is it suspected or proven PCR reported? Do you have any long-standing illnesses, health problems, conditions, or disability? And then there's a nice long list of those. As we know that actually people's susceptibility to viruses is very much dependent on their general health. And the more conditions you have, the more long-term conditions you have, the more chronic disease you have, the higher your risk of catching COVID and having poor outcomes with COVID. We also ask about people's general health-related quality of life. Are you mobile? Are you able to care for yourself? Can you do your usual activities? What's your level of pain and discomfort? And what's your level of anxiety and depression? So this is using something called EQ5D, which is an international measure of health-related quality of life that's recognised by all health researchers. And then very interestingly, we ask about what's your health practitioner been contact been in the last week? Have you been to see a GP, or have you been to hospital? Have you seen a nurse, a social worker, a midwife, a herbalist, a homeopath, etc., etc., etc. There's a nice long list and another box. So we want to listen to not just whether patients have had a COVID test, or whether they've gone into hospital, or whether they're on a respirator in intensive care. We want to listen to everything that patients are doing, everything that the public's doing. Are they taking vitamin D? Are they taking vitamin C? Are they eating a good diet? Are they using homeopathic remedies? Are they using herbal remedies? Are they taking antibiotics? I don't mind. We don't mind what they're doing. We just want to listen in an unprejudiced way as to what they're doing. So that's what we're doing. Who you're seeing and what are you taking? And what's this for? That's it. That's VHawk. So the second thing I want to talk to you about is the National Health Study Practitioner Patient Platform. So the National Health Study is where we've put VHawk. So VHawk is on this platform which practitioners can sign up to and invite their patients to fill in the tool. So we've also got MIMOP up there, which is the one I originally described to you, the Measure Your Medical Outcome Profile, where the patient actually generates the symptoms that bother them the most and then talks about how good or bad they are each time they fill it in. We've also got other outcome measures up there, and we're building it all the time. So this one's called the Perceived Stress Scale. So it's 10 lovely questions about people's perceived level of stress. It's a really cool tool, actually. And then we've got lots more. So this is a quick picture of the dashboard that you have once you join the platform. So you can see VHawk. You can get your patients to fill it in every week if you want. And then there's also the MIMOP outcome measure, where you can get patients to fill it in every month. You can change the frequency if you want. We've also got other questions in there, like the dietary questionnaire, which is an assessment of the quality of people's diets. We've got the perceived stress scale. And also you can actually add your own new plans. You can decide if you want to go off-piste, so to speak, in terms of outcome measures. You can create your own. Although we would encourage you to use ones that other people can use, because then we're all using the same language. And then in terms of analysing the data, we can all understand what each of others been doing. When you join the platform, up at the left-hand side, you assign your patients to join, and you invite your patients to join, and then you assign them to one of these plans or more. They get a text or an email which invites them to join the plan. They fill in the outcome measure, and then automatically the next week they get the same plan, and the next month they get the same plan. There's templates. You can join together, or you can join singly, or you can actually join with your staff. So I've got a staff there of 4. And then there's this wonderful thing, which is the analytics. Yes, so analytics. So you can see here, we can see how many people are filling in the VHawk, how many people are filling in MIMOP. So we've got many, many dozens. I think we're going to be having hundreds by early next week. And then you've got real-time analytics. You can look at this is all the anonymized data that you can look at with regards to your patients, but you can also individually look at each individual patient, but only you and your patient can see the personal data. So lots of real-time analytics there. So if you're interested in this platform, then the best way of joining and having a sample of it is to go and register with HealthWalk. That's our email address. Go to the Health Practitioner page, choose option 1, and then you can sign up for free. So who's it for? Any provider of healthcare or group of healthcare providers. So you could be a homeopath or a group of homeopaths, you could be herbalists, you could be brain surgeons, it doesn't matter. If you're providing health care for people, then this is a fantastic platform for collecting real-time data and from your patients, letting your patients speak. So you get an individual practitioner dashboard, which I've just seen. You get unlimited patient assessments and patient communication. The personal data is visible only to the practitioner and the patient. It's all protected, of course, by the Data Protection Act. And you get the lovely analytics. And the wonderful thing is you can download and share the anonymized aggregate data with other people. So if you're wanting to talk to other healthcare providers, or you want to put something up on your website, or you want to pool all the practitioners in one particular profession, you can pool all your anonymized aggregated data together and you can publish it incredibly quickly. We at HealthWalk will provide support, are providing support to practitioners to get to grips with this new way of enabling their patients to speak. So I'm the data controller dashboard, so I can see all the anonymized data. I can't see any personal data at all. I can run practitioner level and assessment level analytics, but I can't look at anything that's with regards to personal stuff. And I can and will be regularly downloading and sharing this anonymized aggregate data with the HealthWalk team, and we will be sharing it with relevant practitioners registered with HealthWalk and making it public. If we don't do this, what will happen is there's lots of good practice going out there, loads of practitioners in all the different professions who are going to be treating their patients. Lots of patients are going to be using all these wonderful types of therapies, and this information is going to be lost. We will pull together as professions. So I know with the homeopaths, we will pull together, we will bring together all our case reports, and we will share this. But it will not, it's very unlikely that it will reach beyond the homeopathy profession. We will have a great data set of what homeopaths think about what happened to their patients. But at the moment, with regards to how homeopathy is perceived, it is extremely unlikely that this will actually have any widespread coverage. But if we have the patient's voice, this is incontrovertible. It's solid. Nobody can say, well, the patient was lying. The patient has no interest in lying. If we can report how many patients received this type of care, how many patients took homeopathic remedies or herbal remedies, then this will be really powerful data that will be of interest to both the media and the scientific press. So there's a cost to this platform. I've personally invested a 5-figure sum in this platform for the next 3 years. And there is a cost to the texts and the emails that go backwards and forwards. So there is a small cost for us to use this analytics platform. So I've rented a space with an analytics company, a data company. So we do need to, so this is the financial model. What does it cost? Well, if we're a practitioner, actually it's free. You can go and try it free for a whole month and recruit up to 5 patients and see what you like. See if you like it. If you do like it, then I recommend you go for the annual cost, which is a special rate that I've negotiated for our National Health Study platform. You can register and collect real-time data from your patients using any number of outcome assessments, BHAWK, MIMOT, perceived stress scale, whatever, for a whole year just for £60. You can recruit up to 250 patients for £120 and 500 patients for £200. So as a practitioner, you'll have an individual dashboard, which will then, as I said before, the personal data will only be visible to you as a patient, and that's protected. You can download and share your aggregate anonymized data, and then the data controller, that's me and the Health Hawk team, have access to the anonymized aggregate data. So at the end of this, probably in about 6 months' time, we will look at all the practitioners in each of the professions who have been collecting this data. We will then publish a report of all the anonymized aggregate data for each profession. So we will be able to report, hopefully, that hundreds of homeopaths saw thousands of patients who then filled in VHawk and MyMop. And this is what they reported. And because it's the patient voice, this will be of interest to the national media and to the scientific press. So in summary, I hope I've persuaded you of the power of the patient voice. We know as homeopaths, we have and herbalists and acupuncturists, etc. We have amazing tools, we have amazing philosophies and systems for understanding health and treating patients. But the common denominator that brings us in the complementary and alternative medicine world into the mainstream world is the patient. That's the common denominator. And if we can get our patients to speak and garner that data and allow that voice, the patient voice, to ring loud and clear, we can then actually contribute to building healthy health systems. So we at VHawk, we at Health Hawk have created a number of practical tools for creating evidence, for allowing you to, as practitioners, groups of practitioners, as professions, to enable your patients to speak and enable that voice to be heard. So we've got a collaboration of people who want to build healthy health systems, who want to create practical tools and infrastructures and systems for building healthy health systems. So I've described to you the VHawk tool, the Virus Health and Wellbeing tool, and I've also described to you a platform, the National Health Study platform, which means that you can do a click of a button, you can invite your patients to fill in outcome measures and enable them to speak. So what next? First thing I would recommend you do is go and have a look at our Health Hawk web pages and register as a health practitioner with Health Hawk. This means that we'll have your contact details and we'll be able to communicate to you. You'll be able to receive updates and features on this platform. As this platform is getting built, is developing all the time. From September, it's going to be available in a number of different languages. And you'll also be able to access some support and advice. I'd also ask you to share the public survey. So when you go on Health Hawk, you can actually just get your friends and family without registering on the platform to fill in the public survey, the public VHawk survey, and at least we'll have some idea of who's used homeopathy in the general public. We've got thousands of responses so far, so we're very excited about that. And if you're interested in enabling your patients to speak about their care, then join the National Health Study platform. Invite your patients to fill in VHawk or any outcome measure you want. Produce reports on your practice. Help generate the evidence that we need to build healthy health systems in the future, one patient voice at a time. So thank you very much for listening to me today. Stay safe, stay well, and please do come visit us at Hawk Health.